Good day mga ka-learners! Welcome back! This is Dr. Therese and we're here to look at how to get the most from your medicines. In our previous lesson, we learned about common illnesses experienced by many Filipinos. For this lesson, we will look at how to treat these illnesses using the right medications. After studying this lesson, you should be able to identify over-the-counter or OTC and prescription medicines, and discuss the proper procedure in taking OTC and prescription medicines. The common illnesses we discussed in Lesson 1, as well as most other illnesses, can be treated through self-medication. Self-medication involves taking over-the-counter medicines or those that can be bought directly from drugstores and some grocery stores. They're also called over-the-counter medicines because you do not need a doctor's prescription to buy them. There are times, however, when we need to be careful with OTC medicines. Yes, they can treat symptoms of an illness or disease, but taking the wrong one will do more harm than good, sometimes making you more ill. What are the safety considerations in taking over-the-counter medicines? When buying them, you should read and follow the instructions on the label carefully. You should also take the time to check the label of the medicine you are buying. Don't assume that just because two medicines have the same effect that you can take the same dose for both. Also, check to see if it suits the symptom or illness you are looking to treat. It is also important to remember that over-the-counter drugs merely suppress symptoms. They do not cure the disease. It is why they are recommended for minor ailments like headaches, muscle pains, indigestion, diarrhea, fever, and coughs and colds. Some people experience adverse effects from over-the-counter drugs even when they are used properly. There are those who are allergic to some analgesics. An allergic reaction can be as simple as spots appearing on your body, although it can also lead to vomiting or nausea. You should be extremely careful when using over-the-counter medicine on small children or the elderly. This is when you should pay attention to the dose or the amount of the medicine they should be given. Treating children in particular makes it hard to tell if the symptom is from a minor or a major ailment. You see, diseases progress very fast in children because their immune system is less developed than in adults. Let's now look at using over-the-counter medicines for common ailments and find out what common over-the-counter drugs are appropriate to use. Cold medicines come in different combinations and are readily available in the market. They are usually a combination of a painkiller and a decongestant. Painkillers relieve you from pain, while a decongestant relieves you of a clogged and runny nose. Most cold remedies contain a variety of active ingredients that can also cure other ailments, like a cough or a sore throat. If you are self-medicating, ask your parents or your friend to see which one worked for them and work your way to other medicines from there. If symptoms persist for more than a week, check with your doctor or barangay health officer for a prescription, since you may have an illness that cannot be dealt with using common OTC drugs. Commercial preparations for cough are a combination of cough suppressants and expectorants. Suppressants help reduce coughing by acting on a part of the brain that gives you the urge to cough. Expectorants, on the other hand, help you expel phlegm from your body when you cough. Suppressants can do wonders for dry coughs or those with little to no phlegm. But watch out for cough suppressants with codeine in the ingredients. Codeine is a mild narcotic that can suppress your urge to cough, but it can be addictive if you do not take it as needed. If you use an expectorant and you see yellow sputum or phlegm that makes it out of the body, consider seeing a doctor and stop taking it. Painkillers come in two types, paracetamol and aspirin. They usually come in separate formulations, but there are medicines that have both. Paracetamol is considered the safest painkiller. It usually does not have any side effects. It is commonly used to treat fevers as well as aches and pains. It can also be used to treat mild to moderate pain from headaches, menstrual periods, toothaches, backaches, and osteoarthritis. Aspirin, on the other hand, is a stronger painkiller used for minor aches, pains, and fevers. It is also an anti-inflammatory drug. Aspirin, however, is not safe for children under the age of 18, as well as people with asthma, peptic ulcer, and hyperacidity. Full doses of aspirin are also not recommended for pregnant women. Aspirin can worsen someone's asthma symptoms. It also blocks the substance that protects our digestive tract from stomach acid that causes ulcers, upset stomach, and bleeding. If you're allergic to aspirin, you're likely to get rashes or experience mild to severe difficulty in breathing. There are 5 ingredients that are available in non-prescription strengths to treat pain or fever. Collectively, these are called analgesics and are composed of aspirin, acetaminophen or paracetamol, ibuprofen, ketoprofen, and naproxen. Side effects associated with analgesics vary depending on the medicine and how your body reacts to it. If you have been diagnosed with any illness or chronic condition, if you're being treated with other medications, or if you're pregnant, it is best to consult your doctor before taking any of these medications. Heartburn, indigestion, and a sour stomach are a few of the many terms used to describe what doctors call gastrointestinal distress. Self-medication for heartburn and indigestion is risky because it may cause a change from minor dietary difficulties to more serious ones. At times, symptoms of heart disease may feel the same as having a heartburn, but if this happens after eating, you should be in the clear. To treat these, we use antacids and indigestion aids. The goal for antacids in particular is to neutralize stomach acid by reducing the amount produced in the stomach. Antacids, however, can have unwanted interactions with prescription drugs. It's best to check with a pharmacist in case you are taking prescription medicine and are in need of an antacid. Now that we've gone through some over-the-counter medicines, let's look at prescription medicines. These require a written order form called a prescription from a doctor. The prescription authorizes a pharmacist to give you a particular medicine. Prescription drugs are used to treat more specific medical problems. These are more powerful and have more side effects than over-the-counter drugs. It is dangerous to take these without the proper guidance from your doctor. Here are a few tips to correctly use prescription medicine. Ask questions so you can understand how to take your medicine before you leave the doctor's office or pharmacy. If you cannot get them all at once, fill all medicine prescriptions promptly and renew them before they run out. Take medications on time. If you will likely miss a dose, ask your doctor or pharmacist beforehand. Report any side effects or adverse reactions to your doctor immediately. Consult with your physician before stopping them. Always discard outdated or expired medicines properly, just like you would do with face masks. Do not take a larger or smaller dose than prescribed. Ask your pharmacist about ways to keep track of your medicines, like using a pill box with sections for daily doses. Never use medicine from a package that has signs of tampering, damage, or imperfection. Here are a few common mistakes that people do when taking prescription medicine. Not getting the initial prescription filled or failing to refill when indicated. Underdosing. This is when you take less medicine than is prescribed or skipping doses entirely just to make your supplies last. Stopping a medicine too soon. Overusing medicines. Taking doses of the medicine at the wrong time of the day. Before we end this lesson, let's look back at what we learned. Over-the-counter medicines. These can be purchased without prescription. They are intended for relief or minor diseases. These are considered safe if warnings and directions are followed, and may be harmful if misused. Prescription medicines require a written order form from a doctor before a pharmacist can give them to you. Common colds are usually treated with drugs that combine painkillers and decongestants. Still, the most effective way to treat colds is taking lots of fluids and rest. When your cough is dry, take a cough suppressant to control the urge to cough. Expectorants to expel out phlegm. For pain, paracetamol is the safest you can take. Aspirin is a good pain and ache reliever as well as an anti-inflammatory, but it can lead to an upset stomach if not taken properly. That's it for a lesson on medicines for common illnesses, mga ka-learners. Did you learn something new from this lesson? If you did, make sure you apply what you learned the next time you go out and buy over-the-counter or prescription medicines. Stay tuned for our next lesson when we look at how to take the correct dose of medicines. See you then!